Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes discussing some of the most common ways of cementing business that you have procured during the annual election period and throughout the year to not only solidify that business in the household, but to take care of the additional needs that in many cases aren't covered or not covered fully enough by the choice of the base medical programs that our beneficiaries and our book of business have taken out during the annual election period and throughout the year. So we'll be spending some time speaking to some of those programs with a special guest speaker. Today's presentation is being recorded and it will be available to everyone as it uploads on our website at premiersmi.com and on our YouTube channel as well. We will be sending out some follow-up information to make certain you have the detail that we've discussed today as well. You'll notice that in the software package, it has a section for both questions and chat. We'd like you to put your questions in the questions section. Now that sounds silly, but we find that we answer most of them through the course of the presentation, but we want to make certain that you have all the detail you need in order to have the wherewithal to follow up on this presentation, to offer it to your clients, and so that will come to you as well. That said, let's do a little bit of level set as to who our organization is. Many of you are very familiar with us, some maybe not so much, but Premier Marketing is a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform with offices across the country, contracted in all 50 states. We act as an insurance services wholesaler with independent insurance agents, and we work through contracts with folks such as yourself at the highest possible commission levels with recruiting contracts available to those who qualify. We do so through a full portfolio of products that include Medicare programs, the base medical of Medicare Advantage and Medicare Supplement plans, and the standalone Part D prescription drug programs, but we also cover life insurance and annuity products, have a full portfolio of life insurance programs that include final expense and pre-need plans, long and short-term care programs, disability income plans, ancillary benefits like what we'll speak of today that include dental, vision, hearing programs, critical illness cancer plans, hospital indemnity programs, and accident and telehealth programs as well. When we speak to the Medicare Advantage programs, we have the national carriers for you with our organization, along with many of the strong regionals that can make a difference for you in your market. And that same philosophy carries over into the prescription drug programs where they're laid out there for you for use through our organization. We want to make certain that we cover all aspects of care for the population we serve, the Medicare beneficiaries. And so that includes the spectrum of programs that are available, including Medicare supplement plans, that we have a very robust portfolio for you and programs set up to help you be successful in that space within the Medicare arena as well. When we speak of the ancillary programs, as we will today, in each of the categories, we have the national leaders there for you, and we want to make certain that this serves not only to best serve your prospects and clients, but also create additional marketing activities and income for you and your agencies. When we speak of the Medicare market, we're looking at a number that is staggering, plain and simple. You come on a presentation today, we speak of the aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day. But if we look at Medicare based just on age, we have an incremental arc of numbers of people that are coming on, but that number is changed a little bit as to how we access it. We're finding that a number of people at the age of 65 and above may defer full participation in Medicare for one reason or another. The pandemic has had an influence. Many people are working past the age of 65 because they choose to do so. Some are looking at it because, hey, I want to take full Social Security benefits and I need to kind of age into that program as well. So you got a number that's a little bit different than what we had in the first slide. We have to take into account that population that's under the age of 65 that qualify for programs such as we discussed today, and that's 15% of the Medicare population. This is a great outreach for that population as well, because they have needs in this area that we can satisfy. And that's important because we want to make certain that we address the chronic conditions they may have. 2/3 of the population on Medicare have 3+ chronic conditions, and we want to help them budget for some of the inevitable expenses. And we do so through programs that can be addressed with a simple monthly premium, so we can deal with some of the income and savings issues that people may have that we deal with. And we do this simply because they have choices. When someone comes on Medicare, they can defer Part B if they want to. Most don't. Some will pick up just a standardized, modernized Medigap policy to cover some of the shortfall in the medical and pick up a drug plan, or pick up a drug plan on its own. But many of them are now going into Medicare Advantage programs. The old American pickers say we bundle everything into a single package. Whatever choice someone takes, we want to make certain that we can help them, and the programs we discussed today are a great value in this area. What we've seen, according to research from some of the folks that we work with, is in the past you've had a pretty simple, nearly even split when people are aging in to Medicare, or including the late to Medicare seniors, where they're doing a pretty even split between Medicare Advantage and Med Sup choices. You see a section on there that says original Medicare only. That can include dual beneficiaries, people who have both Medicare and Medicaid. It might include people who have retirement programs and VA benefits, or they're just self-insuring. But what's happened with the pandemic, we've seen a bit of a swing as to what they're doing for their base medical. So we're seeing additional growth in Medicare Advantage and some steady production in the Medicare supplement arena. Once again, whatever the choice, the programs we discussed today can help the folks we visit with. And we want to make certain that we communicate with them properly. So part of the follow-up you'll get is a link to this guide from Medicare Learning Network, which gives you a translation of the acronyms that are so prevalent in our industry. We want to make certain that people we discuss our programs with know what we're talking about, and this can really help do so. I've been in this segment of the world for 25, 30 years. There's always a new one, and sometimes it's very, very helpful to have a guide to help explain some of the acronyms we run across. And we do so regardless of the election periods, the time that we have with the Medicare population. We've just recently completed the annual election period, and many folks are looking at their programs in greater detail to see if there's something they still need. So the population is looking at the offerings that are out there still, and agents are also looking to go back and confirm that this new enrollee is now a client, now part of my book of business, instead of just an enrollee. And doing so with ancillary programs helps cement that business to us. Our persistency is stronger with additional benefits in the household, and it doesn't matter which of the standard election periods we're in order for this activity to take place, or if we even use one of the more prevalent and common special election periods that are out there in order to help with the base medical. Because hey, there's a ton of SEPs, and the majority of people on Medicare can qualify for one or another. It's a question, is that the best means for them to use? Or like a discussion I had with a beneficiary this past week, where they are in need of dental insurance, and they were attracted by one of the many commercials that we see, and they didn't want to wait for any other type of changes. So they looked at, how can I make my choice now? Well, you have all the standard enrollment periods you was still in. You have the base SEPs, the special election periods, and we see the government helping out, in a manner of speaking, with different additional periods where a person can change based on weather or other circumstances. We want to make certain that we do so correctly. And one of the things you'll find in part of your follow-up is this link to the FEMA website and a listing of those additional special election periods that can help you as well. We go through all this and speak to it, and I mentioned that people are now looking, gee, is there something I missed? What am I entitled to? Is it free? All the lovely things that we see coming at us through the television set from former professional football players or athletes or whatever other celebrities are out there. But even with all that exposure, there's a huge portion of the Medicare population that did nothing during AEP and did not evaluate their plans year over year and are in need of our help. Obviously, there's some things we need to do to make certain that they have the proper medical and prescription coverage, because some of that is particularly prevalent in the particularly vulnerable population that really needs our help, whatever that may be by age, income, ethnicity, health circumstances, any of those areas. They are now making certain that, hey, I didn't use the comparison tools, and I need to make certain that I'm looking at this even if I'm in a standalone drug program or a Medicare Advantage plan. This gives us the opportunity to help people with these ancillary programs based on the fact that regardless of what their plan choice is, we can help them. They're not using the government material. They aren't even, probably most of them haven't even cracked the Medicare and U book that they got in October, either by United States Postal Service or electronically. And so they honestly don't necessarily know what is covered. And these tools can help us explain what they need in order to cover the perceived need they have with themselves as well, because they're not using some of the detail out there. That gives us as independent agents a great opportunity to speak with them either virtually or in person. And that's one of the reasons why we partner with different organizations to make certain that we have the technology that's necessary to cover this, because hey, the new normal is never going to be the same as the old normal. Tomorrow's not going to be the same as today either, but that's the way it works. We find an increasing number of people that want to do some things electronically, or at least gather information that way, and then perhaps consummate the sale through an in-person meeting. Sometimes it's all virtual, sometimes it's all face to face. But having technology to help in this area can be a big difference. And we look for partners to help us with that. And that's one of the reasons we enjoy our relationship with our guests today, because folks are trained to take information in different manners than what we had in the past. Some folks will think, well, gee, seniors or Medicare beneficiaries aren't as tech savvy. Probably many of them are more tech savvy than I am, but they've had training over the last year and a half, 2 years, where delivery of healthcare by primary care physicians, specialists, hospitals, dentists are coming digitally. Even things in the rest of their life, such as faith-based celebrations or meetings, are coming virtually as well. So having that option to deliver information by a population that's open to that can make a huge difference. I saw a survey recently where many folks preferred an online meeting as opposed to face to face for one reason or another. So we want to make certain we deliver on that, because as we talk to them about dental programs, about hospital indemnity plans, about any other type of coverage, the more programs we have in the house, the better our retention, our persistency's up. You see this, it doesn't even have to be programs with the same company. The base programs that you have out there many times don't offer what we're discussing today. And we want to make certain that we use those programs to satisfy that need, but also keep the business on the books. And we'll see that through these different programs that we have to discuss today. So finally, what we have done today is invited our friends over at Surebridge to come and discuss some of the programs that they have available for us. And we have a guest speaker today, Mr. Seth Groff, who is the sales director for Surebridge. He's going to give us some of the information that we need in order to properly present the programs that are available to this population and address that need in a fashion that is pure Surebridge. So, Seth, I am going to turn control over to you. There you go.
All right. Well,
There you go.
All right, well, thanks, John, for that warm introduction, and thanks all the agents that have joined us today. I know that AEP is over, and I know that a lot of agents like to take a few days off, maybe even enjoy the holiday, and that's fine. You all worked really hard, but I always like to ask a question, and the question that I ask is, if you know the difference between a good Medicare agent and a great Medicare agent. And the answer to that question is that a great Medicare agent, their job doesn't stop on 12/7. It's a year-round commitment to their clients, not only servicing the Medicare products that they sold, but also educating them on strategies to help lower out-of-pocket costs. And so, as John mentioned, today I'm going to talk about two products that you can sell anytime throughout the year. And you can go back to all of your Medicare clients that you enrolled this year or in previous years and educate them on the benefits of these plans. And you don't have to overcomplicate how to do this. I mean, you should be reaching out to these clients regardless. And here's just another reason for you to reach out to them. It's another touch point. And as John, showed that slide up, that it's just going to help increase retention with these clients. And so if you want to be a great agent, don't wait until open or AEP of 2022. Go ahead and you can start talking to your clients about these products immediately. If you're not familiar with Surebridge and kind of what our value prop is to agents and also to clients, is that really we have three goals. We want to be able to offer the best products at the best price and compensate you, the agent, very fairly for selling those products. And as John mentioned, Premier is one of our great partners, and they pass on those high commissions over to you, the agent. But the only way that we can, accomplish all three of those things is by leveraging technology. And so all of our products are going to be quoted and submitted online via point of sale tool. So you're going to have several different signature options. This is very important in the senior market because I know that a lot of your clients are going to have a different level of comfort with technology. But we have a real simple face-to-face signature if you're meeting in person at their home. If you're selling over the phone, you can do an email signature, you can do a voice signature, you can even do a text signature. So again, you're going to be able to align that product or that process with that client's technology comfort level. Also, when you look at our broad portfolio of products, you're going to see products that are going to be either guaranteed issue or they're going to be true simplified issue. So today we'll be talking about Prime DVH, which is a guaranteed issue plan. Obviously, it's because it's a dental vision hearing product. Basically, there's a couple qualifying questions. As long as you're not prospecting in the state penitentiary, you're going to be good to go with some of those plans. Obviously, there's not going to be any health questions on that knocks your clients out. And then other products like our Hospital Indemnity Plan that we'll be talking about today, excuse me, is going to be considered what's true simplified underwriting. And when we say true simplified underwriting, we're underwriting based on the questions on the application. There's never going to be any MIBs. There's never going to be any script check, phone interviews, etc. As long as they can answer the questions truthfully and favorably, that policy is going to get issued. Up on the screen there is going to be our entire portfolio of products. Today, we're really going to be honed in on the senior products, our two most popular senior products, which are going to be Prime DVH and Hospital Wise. But you can see that if you work in the under 65 market, we have a lot of great accident plans available. Also have a standalone dental, standalone vision, great critical illness plan that's also available in the senior market. And so whether you sell in the over 65 or under 65 market, we can be your go-to ancillary carrier because we check most of the boxes when it comes to ancillary products. And you're going to see that we try to make it as easy as possible. So any of these plans up here that has a GI after it, that stands for guaranteed issue. And so that means that there's going to be some benefit available on a guaranteed issue basis, as long as they fall within the guidelines of age band and things of that nature. So point is, large portfolio products, we can be your go-to carrier in both the over 65 and under 65 market. So today we're going to talk about two plans, Prime DVH, which again is a dental vision hearing plan, and then also Surebridge's Hospital Wise, which is a hospital indemnity plan. And you know, on the previous slide where we showed all the products, people are always like, wow, Seth, that's a lot, which is good, but it's, you know, where should I focus on with your products? And I have this little diagram up here for you if you sell in the senior market. If you're primarily selling med subs or your clients have already enrolled in med subs, you're going to want to take a look at Prime DVH. And if you're going to, you know, primarily be selling the Med Advantage plans, you're going to want to take a look at Hospital Wise. Now, this isn't absolute. We sell a lot of Prime DVH to Medicare Advantage clients, but from a high level perspective, this is going to be where you really want to start. And so today I'm going to start with offering Prime DVH to your med sub clients. And remember, Prime DVH stands for a dental vision hearing combo product. And really the opportunity is when you look at your Medicare enrollees, you can see up here that 65% don't have dental coverage. And so yes, your question, why is that, right? And you know, the first cause of it is that a lot of people have dental insurance through work, right? If you work for a corporation or a small business, they offer dental insurance, you have that coverage. You don't really think about it, then you turn 65 and you retire and you lose that coverage, right? So what are their options? Well, their options are, you know, enrolling in an individual dental plan or enrolling in a Medicare Advantage plan that has dental coverage. But the problem is that agents aren't out there talking about that, because you can see that 65% don't have dental coverage. So chances are that if you look at your, you know, book of business, 2 out of 3 probably have a need for dental insurance. And so there's plenty of people out there that you can go talk to. And then also, I know I said that, you know, Medicare Advantage focus on the hospital indemnity plan, but there's still a lot of Medicare Advantage plans that don't have any dental benefits built into it. And so if you're selling MA plans, you really need to look and see what kind of dental benefits they have. Obviously, if there's no dental benefits in the MA plan, then Prime DVH is a no-brainer. And also, if they only have preventative benefits, Prime DVH is going to be something you want to talk to them about as well. Because one of the nice things about Prime DVH is it doesn't coordinate with the Medicare Advantage plan. So they could file the claim through their MA plan and then file the claim through Surebridge, and they get paid for the benefits owed through the Surebridge's Prime DVH plan. So don't completely forget about your Medicare Advantage plans. It's just you need to look at what dental benefits are built into it. And, you know, if they have some pretty good preventative and extensive benefits, you know, it might not be a good fit. But again, you got to look at how much that is, because if there's a limit on it, say $1,000, and they don't feel that's enough, you can still, again, stack this Prime DVH on top of it. So just some of the highlights of this plan. And, you know, we worked really closely with Premier and Integrity in developing this product. And so we really think that it's a plan that stands out amongst the competition. And some of the advantages of this plan include that preventative dental is going to be covered at day one at 100% with no deductible. And so when we were looking at some of our competitors, what we realized is that a lot of times there might be a deductible that they charge even for preventative. And so people buy this plan, go see the dentist, then get a bill, and they're like, well, I don't see the point of this. And so ours is going to be covered at 100% from day one with no deductible. So you can get this plan in force, go get your teeth checked out, a good cleaning on them with no out-of-pocket costs. Also, remember, this is a combo product, so your vision and hearing exams are going to be covered at 100% from day one with no deductible. So you could go see your dentist, you could go see your optometrist, and you could go see your audiologist, all with no out-of-pocket costs and no deductible. And then looking at some of the other dental benefits, your basic procedures, no waiting period tied to that. And then even for our major dental procedures, there's only a 9-month wait for those. So again, we're encouraging utilization, and we want the client to be able to utilize these for those types of service as quick as possible. You're going to see some great premiums, and as I mentioned earlier, Premier can hook you up with some great commissions. And we'll talk about the networks that are associated with this plan on the applicable slides. But the issue ages 0 to 90. It is going to be renewable for life. So if you buy this when you're 90, you get to keep it. You can you can enroll an entire family, and we also allow child primaries. So if you're working with in that under 65 market, or maybe you're even working with a grandma or a grandpa, excuse me, that has a child that needs some dental coverage, we actually allow child primaries on this as well. But great plan in both the over 65 or under 65 market. Guaranteed issue, no health questions. The way that it's going to work is that you're going to select a benefit amount. So you can either do 1,000, 1,500, or 2,000. All services are going to come out of that. So your vision services will come out of that, and your hearing services will come out of that. We'll talk about some caps on those, but you can select one of the 3 different options. There is going to be a $100 deductible applicable to some services, but just remember that the preventative dental and those vision hearing exams aren't going to be subject to that. So let's jump in and look at the dental benefits. So up on the screen here is just a brief summary of some of the things that are covered. I always tell agents to go out, download the sample policy and the product guide. Then you get a full list of everything that's covered, all the exclusions, and you know what's covered in what category. The 2 questions that always come up on this slide, and I just address them right now, is number 1, implants are not covered on this plan, and this plan does not have any orthodontics benefits either. So those 2 things aren't covered, but it's other than that, it aligns with most other dental plans out in the marketplace. And so if you want the full list of everything, like I said, go out, download the sample product or the sample policy, and you'll be good to go. So up on the screen here is how it breaks out for preventative, basic, and major. We already hit on preventative, no waiting period, covered at 100%. And deductible is not applicable. Your basic type services, so you go get that cleaning, they come back and say you have a simple cavity that needs to be fixed. Good news, no waiting period. It'd be covered at 60% year 1, 70% year 2, and then 80% year 3 and beyond, and that deductible is applicable. And then your major type services does have that 9-month wait, but after that 9 months, it'd be covered at 60% for the remaining 3 months, then 70% year 2, and then 80% year 3 and beyond. And right there with that major type service where you get all the way up to 80%, I think that's a huge advantage of this plan. If you look at a lot of other dental plans out there, a lot of times your major services might cap out at like 50%, where with this one, you can get all the way up to 80% because, we want to encourage clients to keep that, and that higher payout encourages that. So with this plan, we use the Carrington network. And the Carrington network has a wide range of providers across the entire United States. I'll even show you how you can look up providers here on a future slide. Whenever possible, I recommend that you go to someone in the Carrington network, but inevitably there's someone on the call that's going to ask the question, what if my client wants to go out of network, right? Maybe they live in a small town where the dentist doesn't take insurance, or for whatever reason, they're not part of the Carrington network. So the way that the out-of-network benefits work is that we use what's called a passive network. And the way that it works is that we actually pay the same percentage up on the screen here. So 1,000 for your preventative, then 60, 70, 80 for basic and major, depending on how long they have the policy. So we pay those same percentages. However, it's capped at the 75th percentile of usual and customary charges. Now, this is where I usually lose agents, okay? It is not 75% of usual and customary charges. It's capped at the 75th percentile of usual and customary charges. So the way that I try to explain it is that imagine 100 people standing in a row, well, not 100 people, but 100 dentists standing in a row in your area. As long as you go to dentist 1 through number 75, it would pay the same as if you went in network. However, if you go to one of the most expensive ones in the upper quartile, or dentist number 76 to 100, it'd be capped at what that 75th dentist charge. So as long as your dentist is kind of in line and charging what everyone else in the area is, you're going to be good to go. If they're expensive, just remember it's going to be capped at what that 75th percentile charges. So, but like I said, whenever possible, go to Carrington because you're going to receive some great discounts and things of that nature. For the hearing benefits, it's going to cover hearing exam, purchase of hearing aids, repairs. And one of the things that get people the most excited is the savings they get through the True Hearing Network. So for the hearing benefits, it utilizes True Hearing, again, wide range of providers nationwide, but you can see up there, they get 30 to 60% savings on hearing aids. And when you start looking at, hearing aids costing $3,000 a piece or, $2,500 a piece, and now you're talking about a 50% discount on that, that's some pretty significant savings. And so, that's one of the things that people get really excited about is just the savings associated through having it through the True Hearing Network. Now, the vision benefits work a little differently. It's going to cover your eye exams, contact lenses, frames, spectacle lenses, follow-up visits, things of that nature. However, the vision benefit is not tied to a network. So the client can go to any provider they want. They would settle up with that provider, and the benefit will always be a reimbursement type benefit. So keep that in mind when you're talking about the vision benefit. It's always going to be a reimbursement. But again, the vision exam covered immediately, 100% all years. The hardware does have a 9-month wait, then covered at 60%, 70%, 80% is subject to the deductible, and the maximum amount that you can allocate to the vision benefit is $200 a year. So remember, you select your benefit amount, $1,000, $1,500, or $2,000, but only $200 of that can be allocated to the vision benefit. So keep that in mind when you're talking to your clients. Hearing benefits going to be very similar. It's going to be, exams covered 100% year one. No deductible applicable. The hardware does have that 9-month wait, then covered at 60, 70, 80. Deductible is applicable to that. But the hearing benefit is going to be capped at $500 every 2 years. So, they could do 250, but what we usually see people doing is using all 500, then waiting till that benefit comes back, just because if you're buying hearing aids, again, they can be pretty pricey. So $500 isn't going to cover them, but it's going to take a chunk out of them, and then they have that benefit available after the 2 years is up. So that's how the vision and hearing benefits work, and I think you can see that as a pretty rich plan for your clients. Up on the screen here are going to be some sample rates. These are issue age premiums, so once you get locked into a rate, there is definitely some incentive to keep that rate, especially if you're working that turn-in 65 market. You can see that if they wait and buy this when they're 66, it's going to jump up in premium. But if they get that premium locked in at age 65, they get to continue to pay the age 65 rate for the remainder of the policy. Will your clients receive an ID card? If you're primarily working in the 65 and older market, they will always receive an ID card. I have a picture of it up there on the screen. If you're selling in the under 65 market, it depends on a question on the application. We ask if they consent to electronic delivery on the application. And if they say yes, they do, and they're under the age of 65, we'll just send them instructions on how they can get it online. Otherwise, just answer that question no, and we'll mail them the card. In order to find a provider, you go out to ChesapeakePlus.com. You can see right down here in the lower left-hand corner, find a dental provider, find a hearing provider. Do not get confused with this find a vision provider. Remember that the vision portion of Prime DVH does not use a vision network. Okay, remember that. That particular plan is for, or that link is for our standalone vision plan, not for the Prime DVH. So keep that in mind. But also some great things you can do up here. You can get an ID card, request a duplicate policy print, change payment information. So this is definitely going to be a website that you want to familiarize yourself with. What should the client say when using the card? At the dentist, make sure they say the Carrington Network. That's what's listed on the card. If they're going to the audiologist, say True Hearing. That's going to be the network tied to the hearing portion. If they're going to the optometrist, I tell them don't even show them the card. Remember, the vision benefit will always be a reimbursement because it's not tied to an actual vision network. Will the dentist file the claim? Yes, if you go in network, the dentist will file the claim. Also, the audiologist will file the claim if you go in network. Vision, remember, it's always a reimbursement, so the client will have to file the vision claim. I know I brought that up 3 times, but it's probably one of the most overlooked aspects of the plan. So just remember that the vision benefit is going to be a reimbursement. John brought up the Medicare and You handbook. And, when you're out meeting with your clients during AEP and, I always say the best way to sell this is just flip into this page right here, where it says that Part A and Part B doesn't cover, and you can see here it doesn't cover most dental care, it doesn't cover eye exams related to prescribing glasses, it doesn't cover dentures, it doesn't cover hearing aids and exams for fitting them. So right here, when you're going through this with your client, or even if you follow up as a reminder, you can point out this stuff isn't covered and that prime DVH is going to be a great fit. Otherwise, I just tell people to call up your clients that you have and, just tell them that you want to learn more about their current dental coverage, and just ask them the question if they're currently going to the dentist. Because regardless of how they answer this question, you can always pivot to prime DVH. Because if they come back and say, I lost my insurance when I retired and I just haven't been going to the dentist, you say, oh, well, is, starting going back to the dentist something that interests you? And they say, yeah, I should probably get back there. You say, oh, great. Let me show you a cost-effective way to pay for your dental care. And then you go into the prime DVH. If they come back and you ask this question, are they currently going to the dentist? And they say, yeah, I am. And you say, great. Are you paying for that out of pocket, or are you using insurance? And if they come back and say, well, I lost my dental insurance when I retired, so now I'm just paying for it out of pocket. You say, oh, well, let me show you a more cost-effective way to pay for your dental care. And then finally, if you ask that question, if they're going to the dentist, they say yes. You ask them if they have insurance. They say yes. You say, oh, does your current insurance also include vision and hearing benefits? Chances are it doesn't, and so there's a chance to talk about prime DVH as well. So regardless of how they answer that question, you can have, or how your client answers that question, you can definitely have a conversation about prime DVH. And then finally, the last thing is I always tell people to know your numbers. You can go out to this website, pull up zip code, look up what the different procedures cost, and you can see here, these are all preventative services. Go out, get these immediately, no deductible, no out-of-pocket costs. That's a $303 value that you can go get immediately. So always, probably one of the biggest objections I get from agents, not from really clients, but agents are always like, I don't see the value in dental insurance. And if you don't use it, yeah, you don't need it. But dental insurance is different than a lot of other things, where that you can a lot of times recoup most, or if not all, of the premium you pay in benefits throughout the year. So just keep that in mind. So that's prime DVH. The last product that I'm going to go through here real quick, and then we'll get you on your way, is going to be Surebridge's Hospital-Wise plan. Again, this is great if you're selling Medicare Advantage plans. So we see more and more people enroll in Medicare Advantage plans. A lot of times it's associated with savings and also additional benefits that are built into them. However, a lot of times these plans come with some additional exposure, and so a hospital indemnity plan can help cover some of the out-of-pocket costs associated with the Medicare Advantage plan. And so up on the screen there, you can see we got some stats. The first one there is just more and more people enroll in Medicare Advantage plans. So there's plenty of people where this concept will apply to. Also, depending on the year, the out-of-pocket average changes, and you can see that it can get anywhere from $5,000 to $8,800. And if you're working on clients that are on a limited budget, maybe they're primarily living on Social Security, it might be tough for them to write a check for $5,000 or $4,900 or whatever the case might be. And so it might be make more sense to buy, maybe allocate 30, 40 bucks a month to have this additional protection, so that if something happens, they would receive cash and be able to pay their portion associated with the Medicare Advantage plan. And from a cost sharing standpoint, the longer they're in the hospital, the more exposure they have with the Medicare Advantage plan. So long term, they usually have a little bit better protection if they enroll in traditional Medicare. So there is some additional risk with long hospital stays, and this Medicare or this hospital indemnity plan makes sense to help offset some of that additional exposure that was created by going with that MA plan. So with that, some of the basics on this plan: issue ages 0 to 90. Underwriting is going to be simplified issues. So again, underwritten based on the questions on the application, never MIB, script check, phone interview, things of that nature. You can do an individual and spouse, they get a little bit better rate, or you can enroll each one's individually. Pre-existing conditions has a 6-month look back for the first 6 months of the plan. So if they've been treated or diagnosed for anything 6 months leading up to purchasing the plan, they would not be eligible to receive benefits for the first 6 months of the policy. Other than that, there's no waiting period. So there's no waiting period for accidents. There's no waiting periods for illnesses as long as it wasn't a pre-existing condition. And then there is a one-time app fee of $20. Most of our products do have that $20 app fee. Prime DVH does not, which is nice. But if you enroll multiple people, it's just one app. Or if you're enrolling them in multiple products, it's just one app fee, which is going to be nice. But the way the plan works is you select a daily benefit anywhere from $15 to $1,000 a day, and then you select a benefit period ranging anywhere from 3 to 365. You can see what's up there on the screen. What you're going to see is that you're going to be able to dial that daily benefit up to align with what their copay is associated with the Medicare Advantage plan. And you can also dial in that benefit period. So you're probably going to select anywhere from a $200, $300, or $400 a day benefit, and then usually a 3 or 6 day benefit period, because that's what their copay is going to be associated with that Medicare Advantage plan. Built into the plan is an observation benefit. A lot of times they hold people for observation. You hit that 12-hour mark and you're not admitted, you will receive the same daily benefit as if you were admitted. You don't get a double dip there. So if they hold you for 12 and then you actually end up getting admitted, you just get 1 day for the hospital confinement. So you don't get a double dip there, but it's nice if you're held for observation then released, between 12 and 24 hours. Also, a mental nervous benefit that pays up to $250, assuming, depending on your daily benefit, for a maximum of 7 days, also depending on your daily benefit, which is nice because a lot of our competitors actually exclude mental nervous benefits in their plan. After you select the daily benefit and benefit period, it's time to look at some of the optional riders. Today, I'm really going to focus on the ones that are going to be applicable in the over 65 market with an MA plan. Lump sum hospital confinement rider, probably not one you're going to look at in the senior market. We do see that sold in the under 65 market to help offset, deductibles associated with ACA plans. But with Medicare Advantage plans, there's not really any deductibles, and we can kind of eliminate that exposure with the base policy and the other riders. But one rider you will want to take a look at is the outpatient surgery rider. Again, a lot of times MA plans have copays with that, and we can dial that in to align with the copay, and we'll pay up to twice per year for outpatient surgery resulting from sickness or injury. Also, skilled nursing facility rider is going to be one you want to take a look at. A lot of times those MA plans have copays days 21 through 100. So we can align that daily benefit up, and we can also select that benefit period of 21 to 100. Emergency care rider, this is one of our more popular riders, pays that benefit anywhere from $100 to $500 depending on what you select, up to 4 times a year for a trip to the emergency room due to sickness or injury. It does have to be an ER tied to a hospital, but it's not contingent on hospitalization. So you cut your finger, you go to the ER to get stitches, you're going to receive that benefit, which is nice. Also covered if you have to go to the ER, you're just not feeling well, doctor's office is closed because it's at night, you need to see someone because you think it's serious, go to that ER, you're going to get that benefit as well. Ambulance rider pays that benefits for a trip on the ambulance, and then your outpatient major diagnostic rider pays the benefits for those exams listed there in that last line there. So definitely those two are ones you're going to want to take a look at as well. Is a wellness rider tied to it? Don't sell much of it. You're just kind of exchanging dollars. I don't recommend it, but it's out there, and so I always make people aware of it because you could see it on the quoting tool. But up on the screen here is really how you sell it. On the left-hand side there, basic hospital indemnity, Medicare Advantage plan, $285 copay for hospital stays for the first 5 days, $250 copay for outpatient surgery, $80 copay for a trip to the ER. Ambulance has a $200 copay. Skilled nursing confinement, $175 for days 21 through 100, and 20% co-insurance for a major diagnostic exam. So what we were able to do here is offer a hospital indemnity plan. You can see we did 6 days at $300 a day. Now remember, this plan does not coordinate. So even if they were still hospitalized after that 5th day and that Medicare Advantage plan kicks in, they would still receive that $300 on that 6th day. So it doesn't coordinate with the plan, but you can dial it in as close as you want. Outpatient surgery rider, able to line that up as we did the emergency care rider and ambulance rider. Skilled nursing rider, you can see we did $200 a day for days 21 through 100 and added the major diagnostic rider for $200 as well. And so we were able to provide this additional layer of protection for only $54.04 a month. And really right there, that's how you sell it. You should be educating them on their out-of-pocket exposure anyways, and then just show them a solution. Just show them the solution. I'm telling you, if you just show them that solution, you're going to be surprised of how many people end up buying it. And you might be saying, well, that sounds good, Seth, but that's a lot of work because I don't want to take the time to go out and, align that. Well, I understand, and Surebridge understands, and we have a tool that actually does all the heavy lifting for you. So when you're out running a quote, there's actually going to be this button up here, the Hospital-Wise Senior Plan Builder. Click on that, and then you can select your plan carrier and your plan name, and it's actually going to show you what the copay is associated with that Medicare Advantage plan, and then it also will show you the solution for Surebridge. And if you like what you see, you can click Updated Selected Plans, and then it actually will quote you for it, and you can show that to a client. And so you don't have to go out and design the plan. Our software will actually design it for you and allow you to make adjustments to make sure that it fits into their budget. Up on the screen here are going to be the knockout conditions with this plan. Remember, this is going to be simplified issue. So if they have any of these major things, they would not be eligible for the plan, but always look for the look back period on this. And because if you're outside that look back period, it's not going to be issue. But this is a good cheat sheet. Otherwise, the questions on the app will walk you through them as well. But my 4 hot sales tips for Hospital-Wise and selling it with Medicare Advantage plans is: number 1, utilize that tool, utilize that Hospital-Wise Senior Plan Builder. Just go out there, run it, show it to the client, and just say, hey, look, this is what your exposure are. This is a possible solution. This is what it costs for you. However, be ready to customize a plan and make sure it fits within their budget, right? Don't try to do a one size fits all. If the premium's too high, start lowering benefits, right? We're showing the best, best solution, but maybe you lower the daily benefit amount. Something's better than nothing, right? Or maybe you lower the benefit period, and maybe you're only covered for 3 days instead of 6. So you got a lot of flexibility there in customizing the plan. I will tell you, we don't see many plans sold over $60. Kind of that $40 to $50 range is kind of the sweet spot. You do see people dialing it all the way down to 30. So just know your clients, and then finally be ready to pivot, right? Just if they say no, say great, and move on. You did your job for educating them. So the last thing that I have for you is just to send it, give it a try. I know AEPs just got over. You probably want to take some time off. That's fine, but make a commitment right now to give it a try to go back and sell these ancillary products. Remember, you could sell these products year round. So it's a great way to supplement your income during the off season of AEP. And again, it's just going to provide another touch points to your agent or client. So don't overcomplicate it. Just call them up, schedule a meeting. Hell, you can sell it over the phone, right? These can be sold over the phone, so you don't even have to go meet with them. But just give it a try, and you're going to have a lot of success. My contact information's up on the screen. If you have any questions, give me a call. Otherwise, John, I'll turn it back over to you and go from there.
Great. Thank you, Seth. We do have one question concerning the dental program. Tammy's asking, is there a waiting period on major services if they've had creditable coverage over the past years?
Yeah, for Prime DVH, we do not waive waiting periods. And so if they've had credible coverage, they'd still be subject to that waiting period of 9 months on Prime DVH. So they'll always be subject to that. I don't like to confuse people, but we do have a standalone dental plan that if you're looking for a plan that would waive waiting periods, you could go with the standalone plan. That would be an option for you if that's what your client's looking for. But just remember, with Prime DVH, it's only 9 months. And if they're planning on going and getting crowns or something of that nature, they probably should stick with their current plan anyways. So the answer to that is Prime DVH does not, but we do have a product that does. It's called PPO Dental.
Thank you. Awesome. I think one of the important points we need to make as well is the fact that these plans pay upon being issued, and so you don't have to wait around like many of our agents are right now with payment for MA until after the first of the year. So thanks, Seth. Really appreciate the information. We'll finish up with just a few slides as to why someone would want to work with Premier Marketing for these programs. And one of the things that we do offer is a system for you to create an agent profile, keep your E&O information, everything else into a singular software program that allows you to contract with multiple carriers very quickly. In many circumstances, we want to make certain that if we can do this as fast as possible, pulling information from here is very helpful. But if a carrier has a direct electronic piece, we try to utilize whatever is necessary to get you set up as quickly as possible. We do offer discounted errors and admissions coverage for qualified agents. What makes you a qualified agent? Well, you got a program with us, you contract with us or something. But this is a program you own. So it's not like being added to a blanket policy for just one program and then worrying about how you're going to satisfy this requirement across the board. This takes care of you regardless of whom you contract through and with what program you're interested in. We do also offer bundled continuing education programs discounted through our association with WebCE to keep your license in play. And you do have an opportunity to take out modified guarantee issue disability income programs for yourself on which you're paid a commission to add to your own benefit structure as well. Much as where today's presentation is being recorded, past presentations have been recorded as well. They're available, as I mentioned before, on our website at premiersmi.com and on our YouTube channel. So you can go back and visit with folks or revisit these presentations and learn about tips and hints to present to centers of influence in the community, specifics on carriers, concepts. They're there for you 24/7. We can't underestimate or not speak enough of the program that we offer without cost to our agents called Medicare Center. This is a plan or a program available without cost to you with a universal login that gives you access to 3 different quoting engines powered by Connexure, Sunfire, and CSG. It is a program that allows you to collect that scope of appointment as you had during the AEP, pardon me. OEP is another opportunity to do so, and there are different electronic and telephonic means in order to do that. We want to make certain that it also gives you the opportunity to store those scopes for that mandated 10-year period, whether you sell them or not. In conjunction with that, having the CRM that's part of the play here, it gives you then the tool to go back and visit with your book of business or your prospects that didn't buy from you, because they're stored in there as well if you quoted them with programs like Surebridge's DVH or Hospital-wise programs. Great way to work throughout the year and manage your book of business. One of the tools also offers an opportunity for you to quote through this system, and that includes dental programs, hospital indemnity programs through Surebridge. And there's a neat program in there that speaks to filling in the gaps. Seth mentioned many of the Medicare Advantage programs with their daily copays. Leave that hole there. Selecting that program through this system, what they already have in play with the base medical, speaks to them about the need that they have to cover those hospital out-of-pocket expenditures. Great way to set it up and demonstrate the need for these programs, all very technologically advanced here for you. We do also offer different incentive programs, a space on our website to take care of the need to know about, well, hey, are there bonus programs in play? Are there other incentives that can make a difference? And how does that affect the Premier incentive programs? All tied in on our website, all available for you there. And we've seen some different changes with that, basically because of COVID. So a lot of our incentives have gone to good cold cash. The days of Cruises, well, we'll see how that works in the future. We also have some different means in order for you to get in front of people. In addition to working your current book of business or the folks that you spoke to lately, well, you can cold call for dental programs. And it's a great way. A lot of agents are actually utilizing a program that may have an increase from 64 to 65-year-olds, creating your own repository of T65 individuals. And it gives you an opportunity then to reach out to these folks before even some of the medical folks have gone into that market. Many folks may have dental as part of their current benefit structure. Some may not, and they may be a very viable prospect for you now. We also have the different programs in play that help you utilize these additional products through other community marketing based programs. And that includes some of the retail programs that have been ongoing, be it Walmart, Kroger, whatever, Walgreens, CVS, whatever retail opportunity many of you have worked with. Many of them are continuing throughout the first of the year through the rest of the year. We want to make certain that you maximize the return on your investment in that area. These programs can really help. One of the things that we do as well is make certain that you can speak to the community about the needs that are out there. Dental programs are demand products, and having a presentation that speaks to that, to perhaps the faith-based community where folks haven't responded to other means of outreach, but will listen to a message delivered through their faith-based family. It's a great way to spread this information live or via virtual reality and make it work. Some of the other things that come into play too is the work with marketing through providers. If you're selling a dental program, working with dentists can be a great opportunity for you. And it's amazing how dental programs reveal other health insurance needs. Conditions are identified by the dentist as almost as frequently as some of the doctors, it appears. So having information on how to work your community can be very helpful. We have programs set up to help you in that area as well. There are different carriers out there that you've worked with here very recently that may still be generating prospects for you, working with these MA carriers. Seth mentioned that sometimes the dental programs aren't as big of a draw in that area, but keep in mind, many of the dental benefits offered by MA programs may not be enough benefit for their prospects and clients, and we want to take care of them in that area as well. And then, of course, the hospital indemnity programs, hey, those are folks you can help. We also offer an internet lead program, and a couple actually, and direct mail support. Direct mail support is based on production, drives down that cost. You can actually qualify for 2 each month, one with health programs and one through final expense. We work through preferred vendors in order to make certain that they do what they need to do for you and that they're doing so compliantly. So that's available for you. All of these vendors have CRM systems, so you can have instant response on these direct mail programs that they offer. We do also make certain that we take care of special needs individuals. And you'll see outreach through the mail for different portions of the population. And this can be very helpful for you in driving up your response on direct mail. And so we want to make certain that you're aware of the possibilities there too. We do have direct mail response programs too, where you don't have the entire mailing at your discretion, but you have access to untouched, fresh mail responses. The cost of these programs vary from year to year or from season to season and from market to market, but it's a great way to fill holes in your scheduling and reach out to people on a ongoing basis at a minimum of out-of-pocket expenditure. Those internet leads are through Facebook. They include final expense and Medicare lead programs, very reasonably priced. They are quick response, but they also require a quick response back to you to make certain that you address the outreach from these prospects that have raised their hands. We do all this because we want your business. Much like you are in the industry in order to make a living, a good living, we do so based on your production. So working with you with overrides and everything else that we can do to help you use some of those monies to further market, hey, it's a mutually beneficial relationship, and we want that with you and hope that you want that with us as well. So it's important, as Seth mentioned, to make certain that you realize you can do this anytime with these programs. The enrollment periods we went through at the first of the webinar don't apply to these programs. So inserting them into your marketing program gives you an opportunity to do so very, very quickly and efficiently. All that said, checking for questions, I think we're good. I want to thank you for the time that you spent with us today. It's your most valuable asset. We realize that, and many of you have felt stretched for this AEP period and are looking for some things that can help you on an ongoing basis. You can do so through these programs, but we thank you for considering us to be your partner in that area. For those of you that have done business with us, we thank you for that. For those of you that are considering doing business with us, we thank you for that. All said and done, however, though, we appreciate the time you spent with us today. You can reach us for additional details through our toll-free number at 1-800-365-8208 or through our website at premiersmi.com. We will be sending out the follow-up. You can respond to that as well. And then our folks in our offices will reach out to you to make certain that we handle any questions that you have and to get you underway in offering these programs to your public. So that said, until we're able to visit with you again, I thank you, Seth, for your presentation. I thank everyone else for coming on with us today. And until we're able to speak with you again, hey, we wish you good selling. Thanks so very much. We'll talk to you soon. Thanks, Seth.
Thanks.